Do you have a PPO Advantage plan this year, and are you in need of finding a new solution for 2026? Hi, I'm Tommy at medicalinsurancetoday.com. I want to talk about the Medicare Advantage plan market today and a bit of a problem that's come up with 2026 plans and what we're experiencing with our clientele. So PPO Advantage has become a very, very popular product over the last probably 8 to 10 years. So Advantage plans, which is about 75 to 80% of our clientele, in the state of California, the Advantage plans have zero monthly premium. They don't cost anything for consumers to enroll into Advantage. That goes for the HMOs and the PPOs. On the PPOs, you have a little higher copay, a little higher expense when you use the plan, but it comes with advantages in terms of you don't need a primary care doctor and you don't need referrals to go see specialists, which will allow you to move around freely and to see doctors that you want, even if they're in network or out of network, and it gives you a lot of latitude in your care. Now, what is happening and the problem we're addressing here is that in the year 2026, UnitedHealthcare, Blue Shield, and Anthem Blue Cross are pulling their PPO Advantage offerings in the state of California, which I'm presuming is leaving hundreds of thousands of people out there statewide looking for a new supplemental. Now, there's advantages being an agent that this is keeping us really, really busy. We're helping a lot of folks that are in trouble with losing their plan and finding a new plan. It's also keeping us very busy with our existing clientele and saying, well, we put them into this UnitedHealthcare or Blue Shield plan, and we're having to find them a new policy. Now, the problem with that is that many people get really attached to their insurance company and the plan that they have and don't like to make change, especially seniors over the age of 65. They get it, obviously, generally are dealing with healthcare issues that younger folks are not, and it becomes a challenge for them and having to go find a new policy. There is a solution, though. That's what I'm bringing this video to the table about, is to talk about the solution. There are two companies that we're offering and that are offering the PPO Advantage. Number one is Aetna, and number two is a company called Alignment. Now, Aetna, most people will know the name, Aetna. Aetna has a gigantic nationwide presence. They also have a gigantic nationwide doctor network. So most of our clientele are moving to that Aetna offering if they're staying in the PPO Advantage market. The Aetna policy comes at zero premium in Southern California. And as I said, most people are going to the Aetna plan because of the brand name and the policy structure and the doctor network. Now, Alignment's a new company to us here at Medical Insurance Today. We started offering it a couple years ago. We don't have a large base of clientele on it, but I can tell you they're growing in brand name recognition. Alignment is. They have a great network attached to it. In California, the Alignment policy comes with a $45 premium. I would say that zero premium with Aetna and the $45 premium with Alignment is what's driving most people to go with Aetna. Most people like their zero premium Advantage plan, and I can't blame them. Why would you want to pay for something when you don't have to? And I'm hopeful going into the new year, as the shutdown hopefully expires this week, and as we get some clarity on what's going to happen with healthcare going into the new year, I'm hopeful that these companies will bring back their PPO Advantage offering. But I'm also preparing for the potential worst case scenario that all these companies pull their PPO offerings. And I'm having that distinct conversation with all my clientele that this could entirely go away. Now, there's a whole nother market that I haven't talked about in this video that's called Medigap Supplemental. That's traditional, go to any doctor nationwide. Why 75% of our clientele are on an Advantage plan is because of that low premium. When you go to a Medigap traditional supplemental, you're going to spend $200, $300, $400 a month to go that route, to go to any doctor that you want to with no questions asked. And most people are trying to avoid that expense. Hence why the popularity of Advantage plans is because of that monthly cost and the low premiums. So there is a solution for anybody out there that's dealing with this. If your plan is expired, we don't charge any fees for what we do. We get paid by the insurance companies, and we are very knowledgeable on how the plans work, how to talk you through the details. We'll look at your doctors and your medications, make sure that we are placing you into the right plan to make sure that you have secure healthcare in the year 2026. And what most of my clientele are coming around full circle is saying, well, I'm not going to pay for a supplemental, and if Aetna and Alignment pull their PPO offerings next year, we can reassess that at that time, and we have secure healthcare for the next year. And that's what we're finding with most people. We do have a large client base with Aetna already, so it's kind of a natural transition for all these people that are losing their plan to move right into that Aetna or Alignment plan of your choice. So if you are in this predicament and having a look at your healthcare, today is November 11th. We have a short window of 3 to 4 weeks. December 7th is a hard deadline for Medicare open enrollment, the annual election, I should say, to start new coverage in January. Please reach out to us. We'd love to help walk you through this. It takes about a half hour to 45 minutes in total, all in. and you will have, number one, a new policy for 2026. And with Medical Insurance Today, you'll have a whole team of very knowledgeable, licensed, bilingual staff behind us that can help answer your questions throughout the year and help you with the transition to your new plan. We would love to help you. Please find us online, medicalinsurancetoday.com, based out of Costa Mesa, and we look forward to serving you.